There are countless reasons why a patient may not be happy with the care they are receiving. One of the main things I hear from patients who come to my clinic is that they feel like no one is listening, let alone hearing what they are saying. There are many reasons a patient may feel this. An average visit with a provider is around 5 minutes. A portion of that valuable time is always filled with paperwork, the provider sitting in front of a computer, and the provider asking the questions that they need to ask, not necessarily the questions that you have. This leads to poor communication. A recent study found only 21% of patients feel communication with their provider went well, while 75% of doctors believe they communicated satisfactorily with their patients. This is a big disconnect in the doctor-patient relationship. Learning how to take your time, ask the necessary questions, and advocate for yourself is key to improving communication and ultimately your healthcare team. Here are a few ways you can proactively increase communication with your provider. Prepare your appointment in advance. Before your doctor's appointment, have an idea of how you want your time with your doctor to go. Think about all the things you want to cover during your appointment. Think about labs, tests, images, medications, supplements, foods, interactions that you may need to bring with you. Make sure that you talk about what you want to talk about, in addition to what the doctor recommends. Writing notes. Bring notes and questions with you to the appointment. Here are a few things you should include in your notes. What is the goal of your appointment? The symptoms you want to address, concerns you have, questions you need answered, any research or studies you may have questions about, even if it's from Dr. Google. Tell your story. Tell your doctor your story. Don't simply say my joint hurts. Explain to your provider when you feel it started, what happened when you first felt the pain, how it feels now, how often you experience the pain. Tell them the story of your health issue or condition. This is much more beneficial than simply saying yes or no. When you are sharing your story, try not to diagnose yourself first. Instead of saying, I think I have arthritis, you can say my wrist and my finger hurt. It started here. It feels like this when I do that. Let your provider give you a fair, unbiased opinion. Don't be afraid to speak up. This is the time to be straightforward. If you feel like you aren't being heard, tell your provider. Try say something that sounds like, I need to talk with you about my fatigue. Can we talk about this? Or, I don't think we're on the same page. Can we talk about my fatigue in a different way? The way it affects me? I know you are busy, but I need to talk about my fatigue. When can we talk about my fatigue? Can you help me understand my fatigue? Can you explain my fatigue? At the end of your visit, repeat what your doctor instructed you to do. You can do this by saying something like, just to be clear, you want me to do X, Y, Z, and then schedule another appointment with you in 3 weeks. Is that correct? In the notes section of this lesson, I created a list of questions for you to take with you to your next appointment, whether it's your primary care provider or your specialist. I recommend downloading the document and keeping it with you in your purse, your car, or somewhere you will not forget it. Maybe take a picture of it so it's always on your phone. Bring this with you every time you visit a provider to make sure you are not forgetting to ask something that could have a big impact on your future health. These steps can help you make some real changes in how you communicate with your provider and how they communicate with you. Being your own advocate is about picking the right health team and then working hard to communicate well with them as well.